Let me ask you a question, Dr. Collins. If I were to ask you whether or not NIH research was part of the development of a certain pharmaceutical drug or part of the development of a certain medical device, could you trace the lineage of the research so that you could tell me a yes or a no if NIH was involved?
I think usually we could, and in about 75% or so of the questions of that sort you would ask, the answer would be yes, NIH played a role. Not necessarily a direct proximal role to the ultimate product, but discoveries that happened at an earlier point leading to ideas about mechanisms, leading to ideas about possible therapeutics. Yeah, you can connect those dots, and those dots almost always involve NIH research in some way.
Well, let me tell you why I ask you that question. We're all sitting here wearing clothing and suits and such, and somewhere there's a label inside where it's made. And we go out to the market and we buy products, and we have an identity of the producer and contents. And I think it's about time that the NIH had a label that is applied to pharmaceuticals and medical devices and other things where you can connect the dots. I think it's time the American people came to hear the National Institutes of Health being referred to on a regular basis as part of the sourcing of the great things that are happening. You have so many miraculous stories to tell. And I don't know if you did a survey across America, how many people would be able to identify what the letters NIH stand for. I think it's time we do something about it. We pass laws about the labels on my suit and the labels on products. And I'd like to ask the chairman and others to think about joining me in a bipartisan effort to make sure that credit is given where it's due, so that Americans come to appreciate how you are at the heart of basic research that really makes their lives an awful lot better. And so I'm going to work on something, and I'm going to work with you to make sure we do it in the right way.
Well, Senator, I really appreciate your emphasizing the importance of this being more widely recognized. It is true, if you ask people on the street, do you know what NIH is? I think the last survey it was less than 20%. Much higher recognition for NASA than there is for NIH. And yet, obviously, a lot of the taxpayers' dollars going into what we're trying to do here. I would give a quick plug that in August, there is a series on Discovery called First in Human, which follows a series of families that have been treated at the NIH Clinical Center, which you all just visited a couple of weeks ago. It is powerful. It is 3 subsequent weeks, 2-hour segments, and you will follow and see what happens to these patients and their families as they go through what are clearly circumstances that are quite desperate, and that's how people come to us, because all other options have been ruled out. That would be a very good way for America to get a sense about what we do and why it matters so much.
Thank you. Dr. Volkow, we're in the midst of an opioid heroin crisis. Some places hit harder than others, including the home state of my colleague, Senator Shaheen. It is an incredible crisis generated by the production of 14 billion opioid tablets a year in the United States of America, enough for every adult to have a 1-month prescription to opioids. That production number is approved by the federal government each year, the Department of Drug Enforcement Administration. And then, of course, it gets into the general population through scripts written by doctors. CDC has warned these doctors, don't overdo it except in extreme cases. I know you're looking closely at this and couldn't join us when we visited, but would you comment on the fact that, at least at this moment, the United States government is complicit in the overproduction of opioids?
Well, I think that in the healthcare system, we have to recognize our involvement in creating the opioid crisis. And it was a result of a well-intentioned initiative to treat those patients that were suffering from chronic pain, but without the proper education or understanding about the tools that we're using to actually treat those patients, which was predominantly relying on opioid medications. And as a result of that, there was an overprescription that we're currently living. That led to diversion, abuse, and then transfer into heroin and synthetic opioids. What we're doing from the NIH perspective is taking a multi-pronged approach to address it. Recognizing that the need of pain patients was the initial driver we are aiming to actually create public-private partnerships, and this is encompassed by the whole NIH, for energizing the development of alternative analgesics that are not going to be addictive. So that's one of them. The other one is, again, incentivizing the pharmaceutical through these public-private partnerships to the development of alternative formulations for the medications that we currently have for treating opioid use disorders, as well as to developing alternative targets for the treatment of addiction of opioids. And finally, again, through public-private partnership with industry, to develop prevention interventions for overdose, as well as to develop even more efficient reversal medications such as Narcan to address the opioid crisis.
Thank you.